Hello, I'm Dr. Sam Waterling. For many years now, I've worked closely with patients dealing with vascular health, and one of the most common concerns I hear, especially from people over the age of 60, is about their legs, the heaviness, the swelling, the coldness in the feet, the tingling that just won't go away. Today, I want to sit down with you, just like I would with a patient in my clinic, and talk honestly about poor leg circulation in one simple, powerful exercise that can make a real difference. No complicated routines, no expensive equipment, just something you can start doing today. Before we get into it, if you find value in what I share, please consider subscribing to my channel. My goal is to reach 50,000 subscribers so I can keep bringing trustworthy health guidance to more people like you. Now, let's begin. Let me start the way I would with anyone sitting across from me in my office. I want you to picture your legs for a moment, not just as limbs that carry you from one room to another, but as a vast, intricate highway system. Every single day, your heart pumps blood down through your thighs, through your calves, all the way to your toes, and then, and this is the part most people don't think about, that blood has to travel all the way back up again, against gravity, to return to your heart. That return journey is where so many of our circulation problems begin, especially as we get older. When we're young, this system works almost effortlessly. Our veins have healthy, elastic walls. Our valves, these tiny one-way doors inside our veins that stop blood from flowing backward, snap shut cleanly every time. And our muscles, particularly the muscles in our calves, act like a second heart, squeezing and releasing with every step we take, helping to push that blood back upward. We call this, in medical terms, the calf muscle pump. And honestly, I think it's one of the most underappreciated systems in the entire human body. But here's what happens as the years go by, and I see this in patient after patient. The vein walls begin to lose some of their elasticity. The valves, after decades of use, can start to weaken or leak slightly. And perhaps most importantly, and this is something within our control, many of us simply move less as we age. We sit more. We walk less. Our calf muscles, that natural pump I just described, start to go a little quiet. And when that pump slows down, blood begins to pool in the lower legs. That pooling is what leads to so many of the symptoms my patients describe to me. Swelling around the ankles by the end of the day, a heavy, tired feeling in the legs, skin that looks a little discolored or feels cool to the touch, cramping at night, and sometimes those small, visible veins we call spider veins or varicose veins becoming more prominent. Now, I want to pause here and say something important, because I think it gets lost sometimes in health content online. What I'm describing to you today is general education about circulation and healthy movement. It is not a diagnosis, and it's not a replacement for seeing your own physician, especially if you have any known vascular conditions, blood clots, heart disease, diabetes, or if you notice sudden swelling, pain, redness, or warmth in one leg. Those symptoms need to be evaluated by a doctor promptly, because they can sometimes signal something more serious. What I'm sharing with you is meant for general wellness and for supporting healthy circulation in people who are otherwise stable. And I always encourage you to have a conversation with your own healthcare provider before starting any new exercise routine, particularly if you're managing other health conditions. With that said, let's talk about what you actually came here for. The exercise I want to teach you today is one that I have recommended to countless patients over the years, and it's one that consistently surprises people with how effective it is, given how simple it looks. It's called the heel raise, sometimes referred to as a calf raise, but I like to think of it and describe it to my patients as waking up your second heart, because that's really what you're doing. You are directly, mechanically activating that calf muscle pump I mentioned earlier, the one that naturally slows down with age and inactivity. Here's how it works, and I want to walk you through it slowly and carefully, the way I would in an actual appointment. You can do this exercise standing or, if balance is a concern for you, seated in a sturdy chair. Let's start with the standing version, since that tends to be more effective, but I promise, the seated version still offers real benefit, so please don't feel like you need to push yourself into a position that doesn't feel safe or stable for you. Stand with your feet about hip width apart. If you're someone who is even a little unsteady on your feet, and there is absolutely no shame in that, please stand near a wall, a countertop, or the back of a sturdy chair so you have something to hold on to. This isn't about proving anything to anyone. It's about protecting yourself while you do something good for your body. Once you feel stable, slowly rise up onto the balls of your feet, lifting your heels as high as comfortably possible off the ground. You should feel your calf muscles engage, tighten, contract. Hold that raised position for about 2 seconds. Then, slowly, and I really do mean slowly, lower your heels back down to the floor. Don't just drop them. Control the movement on the way down just as much as on the way up, because that controlled lowering is actually where a lot of the muscular benefit comes from. That's 1 repetition. I generally recommend starting with a set of 10 to 15 repetitions, resting for a moment, and then doing 2 to 3 sets total, once or twice a day. But I want to be very clear about something, because I've seen well-meaning patients hurt themselves by trying to do too much too soon. If you are just starting out, and especially if you haven't been very physically active recently, please start small. 5 repetitions is a perfectly respectable place to begin. There is no trophy for overdoing it on day 1. The goal here is consistency over time, not intensity in a single session. Now let me explain to you why this particular movement, this simple heel raise, has such an outsized effect on circulation. Because I think understanding the why helps people actually stick with these habits. When you contract your calf muscles by rising onto your toes, those muscles squeeze the deep veins that run through your lower leg. This squeezing action compresses the veins and pushes the blood inside them upward toward your heart. Then, when you lower your heels back down and the muscle relaxes, those one-way valves I mentioned earlier close behind the blood that just moved up, preventing it from sliding back down due to gravity. Every single repetition you do is essentially 1 pump of that second heart, moving stagnant blood out of your lower legs and back into active circulation. Think about what happens when you sit for long periods, whether that's watching television, reading, or sitting at a desk. During that time, your calf muscles are essentially dormant. There's no pumping action happening. Blood begins to settle in the lower legs simply because gravity is working against it and nothing is working with it. This is part of why so many people notice their ankles look more swollen in the evening than in the morning. Gravity and inactivity have had all day to work against your circulation. By deliberately performing heel raises, even in short bursts throughout the day, you're interrupting that stagnation. You're giving your circulatory system active help, rather than leaving it to work against gravity alone. I often tell my patients to think of their veins like a series of small pumps stacked from ankle to hip. Each contraction of the calf muscle doesn't just move blood a tiny bit. Because of how those valves are positioned, it helps propel blood upward through multiple segments of the leg. This is actually why so much serious research and clinical guidance around vascular health emphasizes calf activity specifically, more than almost any other lower body movement. It's not that other exercises don't help. Walking, cycling, swimming, all wonderful for circulation, but the heel raise isolates and directly targets that calf pump mechanism in a very efficient, very accessible way. You don't need special shoes. You don't need a gym membership. You don't even need to leave your kitchen. I want to spend a moment talking about who this exercise tends to help most, based on what I've observed clinically over the years. People who sit for extended periods, whether due to work, mobility limitations, or simply lifestyle, often see meaningful improvement in that end-of-day heaviness and swelling when they incorporate heel raises consistently. People who notice their feet and ankles look puffier by evening. People who describe a dull achiness in their calves after standing or sitting for a while. And people who simply want to support healthy circulation proactively as they age. All of these are groups where I've seen this simple movement make a genuine, noticeable difference over a period of weeks. I do want to gently mention, because I believe in being thorough and honest with you, that this exercise is a supportive tool, not a cure-all. If you have a diagnosed vascular condition, such as chronic venous insufficiency, peripheral artery disease, deep vein thrombosis history, or lymphedema, this exercise may still be beneficial, but it absolutely should be discussed with your physician first, because the right approach can vary quite a bit depending on your specific condition. Some conditions require careful monitoring, compression therapy, or other medical interventions alongside movement, and no video, including this one, should ever replace that personalized medical guidance. I say this not to alarm you, but because I genuinely care about you doing this safely and effectively. Let's also talk about the seated version of this exercise, because I know standing balance is a real and valid concern for many of my patients, particularly those with arthritis, prior falls, or general unsteadiness. Sit in a sturdy, stable chair with your feet flat on the floor. Keeping your heels on the ground isn't the goal here, actually. Instead, you'll lift your heels up off the floor while keeping your toes planted, essentially the same motion as the standing version, just performed from a seated position. You'll feel the same calf engagement, the same contraction and release. While seated exercise generally produces a somewhat gentler effect compared to standing, because you have less body weight actively loading through the calf, it still activates that same muscular pump mechanism and can still meaningfully support circulation, especially for people who are sitting for long stretches at a time, like during a long flight, a long car ride, or simply a day spent mostly at a desk or in a favorite chair. One thing I always encourage my patients to do is pair this exercise with mindful attention to how their legs feel throughout the day. I'm not asking you to become anxious about every ache or sensation. That's not helpful either, but simply to notice patterns. Do your ankles feel more swollen after a day you were highly sedentary compared to a day you moved more? Does performing a few sets of heel raises during a long period of sitting seem to ease that heavy feeling by evening? This kind of gentle self-awareness helps you understand your own body's patterns and helps you and your doctor have more productive conversations if you do need to discuss vascular health further. I also want to touch on timing and how to fit this into a realistic daily routine, because I know that for many people, the biggest obstacle isn't understanding an exercise. It's actually remembering to do it consistently. I often suggest linking the heel raise to something you already do every day, what many people call habit stacking. For example, you might do a set of heel raises while brushing your teeth in the morning and again in the evening. You might do them while waiting for your coffee or tea to brew. You might do a set during commercial breaks if you're watching television, or every time you stand up from your desk during a workday. The beauty of this particular exercise is that it requires no special setup, no changing clothes, no dedicated block of time. You can do it in the kitchen, at your bathroom sink, at your office desk, or even while waiting in line somewhere, discreetly, in your shoes, without anyone even noticing. I've had patients tell me they set a simple reminder on their phone every hour or two, just a gentle nudge to stand up, if they're able, and do 10 heel raises before sitting back down. Others prefer to do a more structured session, say 2 to 3 dedicated minutes in the morning and 2 to 3 minutes in the evening. Both approaches have value, and honestly, the best approach is the one you'll actually stick with. Consistency, done gently and sustainably, tends to produce far better results over months than an intense but short-lived burst of enthusiasm that fizzles out after a week. Let's talk a little more about the broader picture of why circulation matters so much as we age, because I think context helps motivation. Good circulation isn't just about comfort, though comfort certainly matters, and heavy, swollen legs are genuinely unpleasant to live with. Healthy blood flow also plays a role in delivering oxygen and nutrients to tissues, supporting wound healing, and helping to clear waste products from the muscles and skin. When circulation is sluggish over long periods, some people notice skin changes, a duller appearance, slower healing from minor cuts or scrapes, or a sensation of coldness in the feet, even when the rest of the body feels warm. None of this is meant to frighten you. I promise you that isn't my intention at all, but rather to help you understand why something as simple as a calf muscle contraction carries so much genuine physiological weight. I also want to mention hydration and gentle movement throughout the day as companions to this exercise, though I promise not to overload you with a long list of separate tips, so I'll keep this brief and connected to our main topic. Staying adequately hydrated helps maintain healthy blood volume and viscosity, which supports the same circulatory processes we've been discussing. And breaking up long periods of sitting with even brief standing or walking, alongside your heel raises, gives your calf pump more frequent opportunities to do its job throughout the day, rather than being called upon only once or twice. Something else I want to share, because I think it's genuinely encouraging, is how quickly some patients notice a difference. Now, I always caution against expecting dramatic overnight change, because bodies, especially as we get a little older, tend to respond gradually and steadily rather than instantly. But many of my patients who commit to this exercise consistently, doing it multiple times a day for several weeks, report that the end-of-day heaviness in their legs feels less pronounced, that their ankles look a little less puffy by evening, and that they simply feel more comfortable and mobile overall. Some notice improvement within a couple of weeks. For others, it takes closer to a month or two of consistent practice before they really notice the difference. Bodies vary, and that's completely normal. What matters most is steady, patient consistency rather than perfection. I want to address something else I hear often from patients, which is a kind of discouragement, a feeling of, I'm 60, 70, 80 years old. Is it really worth starting something new now? And I want to answer that as directly and honestly as I can, because I believe it deeply. Yes, it absolutely is worth it. The human body, remarkably, retains a meaningful capacity to respond to gentle, consistent movement well into later life. Muscles, even calf muscles that haven't been actively strengthened in years, can still respond to this kind of low-impact, repetitive activation. Circulation, even when it has slowed somewhat with age, can still be supported and improved through consistent movement. Age is not a wall that prevents improvement. It simply means we approach that improvement thoughtfully, gently, and with appropriate care, which is exactly what this exercise allows for. Let me also speak briefly about proper form, because doing an exercise correctly matters just as much as doing it consistently. When you're performing your heel raises, try to keep your weight distributed evenly across the balls of both feet as you rise, rather than shifting heavily to one side. Keep your core gently engaged, not tense, just stable, to help support your balance. Try to avoid locking your knees rigidly straight. A very soft, natural bend is fine and often more comfortable. And breathe naturally throughout the movement. Some people unconsciously hold their breath during exercise, and I always encourage a relaxed, steady breathing pattern, exhaling gently as you rise up and inhaling as you lower back down, or simply breathing in whatever rhythm feels natural and comfortable for you. If at any point you feel sharp pain, not the mild muscular fatigue that comes from a new exercise, but genuine sharp or intense pain, or if you feel dizzy or unsteady, please stop and rest. Mild calf fatigue after a few sets, especially when you're first starting out, is a normal response to activating muscles that may not have been challenged in a while. But pain that feels sharp, or any sudden swelling, warmth, or discoloration in one leg is a signal to stop and reach out to your doctor, not something to push through. I mention this not to worry you, but because part of genuinely caring for a patient, or in this case, someone watching this video, is being honest about when professional evaluation is the right next step. I'd also like to speak to those of you who might be caregivers, watching this on behalf of a parent, a spouse, or another loved one. This exercise is wonderfully well suited to being done together. There's something genuinely nice about doing a set of heel raises alongside your loved one at the kitchen counter, both of you holding onto the counter edge for stability, chatting while you do it. It turns a health habit into a small shared moment, and in my experience, patients are far more likely to stick with new habits when there's a social or supportive element attached to them. As we come toward the end of our conversation today, I want to circle back to the core message, because I think it's easy for information like this to get complicated, when really, the heart of it is quite simple. Your calf muscles are a natural pump for your circulatory system. As we age, and as we tend to move less, that pump can become underused, contributing to the heaviness, swelling, and discomfort so many people experience in their legs after 60. The heel raise, this simple rise onto the balls of your feet and controlled lower back down, directly reactivates that pump. It costs you nothing. It requires no equipment. It can be done virtually anywhere, standing or seated, and with consistent practice, ideally a few sets, a few times throughout the day, many people find real, meaningful relief in how their legs feel by the end of the day. I always tell my patients that health, especially as we get older, isn't usually about dramatic, sweeping changes. It's about small, sustainable habits practiced consistently over time. This exercise is a perfect example of that philosophy in action. It doesn't ask much of you, just a few minutes scattered through your day, but done consistently, it can genuinely support your circulation, your comfort, and your overall quality of life. Before I let you go, I want to remind you once more, please, if you have any underlying health conditions, any history of blood clots, vascular disease, heart conditions, or if you're simply unsure whether this is appropriate for you, do have a conversation with your own physician before starting. I say this not as a formality, but because your safety genuinely matters more to me than any single piece of content I create. Used appropriately and in the right context for your individual health situation, I believe this simple exercise can be a wonderful, accessible tool for supporting healthy legs as you move through your 60s, 70s, and beyond. Thank you so much for spending this time with me today. If this explanation helped you understand your body a little better, or if you think it might help a parent, a friend, or a loved one who's been struggling with heavy, tired legs, please do consider subscribing to my channel. My goal, honestly, is to reach 50,000 subscribers, and every single person who joins helps me continue creating clear, honest, medically grounded health content like this for people who need it, Take care of those legs of yours. Be consistent, be gentle with yourself, and I'll see you in the next one.